again. Oh, wait, are we singing? No, we're not singing.
God, I hope not.
No, there'll be no singing. Actually, I can't promise that.
No, you can't.
Hi, everybody. It's that time again. That's Dr. David Klein from Stages of Life Medical Institute, and we are a little over a minute away from starting the radio show. Right now, we're just on the social media, so if you would, share if you care. And, no, seriously.
So we're still trying to decide what to do the show on. So, yeah, we do kind of keep it fresh. In other words, we don't script these things.
Keep it simple for the fresh people. That's what it is. It's really not what it is. So 45 seconds before we go live on the radio. So let's get some stuff out of our hair here. You can check out Stages of Life Medical Institute all over the internet. Just go to stagesoflifemedicalinstitute.com. Dr. Dave set up a splash page so that you can go to all kinds of facets of his web, his radio page, his recorded stuff, things you can download. It's incredible. It's a true story. It really is. Okay, so anyway, give me 15 seconds. Yay! I just changed when this intro goes off. That's all. So let's see what happens. 10 and 5 and... Okay, here we go.
Broadcasting live from the United States of America.
Well, that's different. Hey! Wow, we start things off differently every time, it seems now at this point.
Well, it keeps us on our toes.
Woo! Welcome to Stages of Life Medical Institute's show called Stages of Life Radio with Dr. David Klein. Melissa Fox here, having fun already. Wow, good times. I have no idea what happened to the intro. It just went... So, wait. Oh, here it is. I think I've got it. Wait a second. Let's just do this number right here. And...
Yes, it's live.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212. Or text 23680.
What she said.
Now we know how to get a hold of ourselves.
Yes. Hang on to yourself. Okay, here's what's going on, my friends. We are doing a live show, call-in show, and it's with Dr. David Klein. 5 board certifications, a handful of them in pain management. And for those of you just tuning in for the first time, give us a little more background on the man, the myth, Dr. David Klein.
Well, as Popeye once said, I am what I am. I'm trained in the United States. I did my high school, here in the United States. And that ought to be one of your first criteria in selecting a physician, is where did you go to high school? Because it'll give you a general idea whether or not you share many of the same social values, and frankly, it's easier to communicate with somebody with whom you have some commonality. Very important, especially in psychiatry. But when you're looking at somebody's overall health, it's really nice to be able to understand the subtleties of the language. So I studied here. I got a degree in chemistry, another degree in psychology. Went to University of Maryland for medical school, subsequently general surgery, family practice, as well as anesthesia. And I don't do any of the above, which is kind of interesting, right?
Great.
So I started off doing intensive care, went from there down on the line. I've been published over 100 times. I've been on 5 medical school faculties. I've been on the air doing radio stuff as a hobby for the past 25 years, and it is an enjoyable way to earn a living. I love it. It's fun. So if you can't enjoy your life, you're destined to have just to be a miserable person.
Look, you can't have fun. Why bother?
Why bother? So I love what I do. And so the question is, my wife Tess, my dear lovely wife Tess, who refuses to come on the air, which is really kind of okay. Otherwise I'd be getting telephone calls. She'd be getting telephone calls from people trying to solicit her to do, other things.
Right.
In other words, work her way away from me because she's really kind of cool.
Mm-hmm.
So what do? At Stages of Life, we're a little bit different than the typical medical practice. What do I mean by that? Well, we look at the entire person, which is something I was trained to do back in the mid-1970s. You look at the entire person. Try finding a physician these days that really can understand the entirety of your problem. Doesn't mean that somebody needs to do neurosurgery as well as dermatology, pulmonology, and endocrinology all at one time. Oof. But it's very, very nice to have somebody that understands how these things work together. So at Stages, we are functioning as a family practice. We do everything there short of routine, gynecological care, which is not something I really care to do anymore. I did plenty of that earlier in my life. I just don't want to be bothered anymore. We have our own laboratory.
Thanks, Doc.
So why do we need our own laboratory? Mm-hmm. This is absolutely the most important part of all. I was an analytical chemist before I became a physician. All right, I thought that would seem to be kind of a little bit of a bizarre way to start my life off. However, it has come out extremely handy after I decided I wanted to get into laboratory medicine. So attached to my office, an integral part of my office, is what's called a highly complex neuroendocrine laboratory. So we're able to draw blood from our patients, walk it 90 feet to another door, which is the security door to the lab. We have $1 million worth of equipment in there, so we do have a locked door and all manners of security. But we run the blood, and it's done very, very accurately. And you're going to wonder, well, gee, what difference does it make if I send it to LabCorp, Quest, or any one of a dozen other laboratories? And the answer is this. If you took a glass of milk and mailed it in a test tube to any one of these other laboratories, and it could take 3 to 4 days to get there, sometimes longer, depending upon the type of study that has to be done. It could be up to a week. Do you think the milk would taste the same on the other end? And the answer is obviously not. Blood is a whole lot more complicated than milk. And so when you're looking at the type of chemistries, the type of analysis that we have to do, having it done immediately after it exits your arm, is really important. So we get very, very accurate results. So when you go to the big box labs, they draw your blood. And the first thing the technician does typically is shake it. Take it. So they shake the blood. Okay, you need to understand how exactly wrong that is, because the red cells will break down when you do that. You have to be ginger with it. They need to be set down with some care. If they need to be mixed with the anticoagulants, the blue tops, purple tops, they have a little bit of anticoagulant in them. You have to gently flip it from side to side and then gently set it down, or you end up with elevations of liver enzymes in particular. So for decades, I do mean decades, I was sending people off for hepatitis workup simply because the laboratory technician, the phlebotomist, the person drawing the blood, would shake the tubes before they sent them to the lab. So there are lots and lots of people out there that spent millions of dollars on hepatitis workup where it was absolutely unnecessary. And this is true of lots of things. Many of the proteins that we look for in the blood degrade with time, but they also degrade with temperature. So we take the blood, spin it, freeze it, or run it immediately.
What? No shaking?
No shaking. The accuracy is really what this is all about. And so what else do we do? Well, we're the first doctor's office in the world, from what I've been told, that was able to do molecular genetics testing. Now, that's not what you think it is. We don't care about your genetics. I don't really care whether you are who you say you are. But what we do is we look for molecular genetic determination of infectious disease. Now, think about this one for a second. So if 1/3 of all people in assisted living facilities, and really 1/3 of all women, if you take the larger population, will end up with urinary tract infections at some point in their life. Half of those will end up with recurrent, and it's the leading cause of sepsis and death in patients in nursing homes, urinary tract infections, right? So what do you do? Well, we're gonna send a little bit of urine to the laboratory. Okay, that's usually a chore right there, because the people that transport it don't get paid a nickel to take that urine. So it doesn't really get the highest priority. Once it gets there, it's allowed to sit for 3 to 5 days while it grows, and it has to take time to grow on a routine culture and sensitivity. Then half of them come back as being contaminated samples because there's more than one bacterium present. So you get no answer. Now, meanwhile, your grandma is getting hotter and sicker and sicker and hotter. They throw antibiotics just guessing what's going on because that's the state of the art these days, and it's a 70-year-old approach to diagnosis. At Stages of Life, what do? We take the urine and we run it through a DNA analyzer called a PCR, a polymerase chain reaction. We have 2 of them. Not 1, but 2. We have one really big one, a fast one that can do 1,000 samples an hour, and we have one that can do about 6 to 8 per hour. Now, what does it do? It's able to look for as many as 30 to 40 different pathogens in that urine. And it does it by DNA analysis. Now, I don't really know what understand about urine infections, but most of them involve more than one organism. And the reason for this is anatomical. It's very easy for the urinary tract to become fecally contaminated, in women in particular, and men if they're really sloppy. But that's just the way that it goes. So fecal material, poop, to those of you that don't understand, such as it is, I declared up for Melissa. So what do? All right. It is 90% bacteria, and it's not one type of bacteria. It's not just E. coli, but it may be one of 200 or 300, 400 different types of bacteria. So when you end up with a urinary tract infection, it can be a fast-growing bug like Proteus or E. coli, but it could be Morganella. It could be a bunch of different things that take a long time to grow, in which case you end up with either sterile samples or you end up with the wrong thing. At Stages, we are able to figure this out in as little as 12 hours.
Every Sunday we do this, 4 to 5 p.m. Oh, yeah. Melissa Fox along with Dr. David Klein. He's the guy with all the medical knowledge. I just push buttons.
You do a great job pushing my buttons.
True, that's true. More information on anything we talk about or any of the nutraceuticals that Doc might reference, you can get information at stagesoflifemedicalinstitute.com. You're listening to Stages of Life Radio on News Radio WFLA, Orlando. Pretty slick.
Yeah, it's pretty cool.
Yeah, well, I mean, I got a timer and stuff.
You've done this now for at least, 2.5, 3 years now?
What, your show?
No.
Oh, radio?
Just in general. Longer.
Since 1981.
Long time.
Long time. Okay, so we're taking your questions on the internet if you're there. I see a lot of people that are like waiting on the wings. Apparently, they're waiting for you to say something profound.
Okay.
So you have 3 minutes to do that.
In the next, right, okay, I can do that now. But in the next section, what I was going to do is I was going to pose the following question, and I will do it right now for those of you that are loyal watchers, as it turns out.
Wait, looks like we got one.
Hold on, let's bring it in.
Careful, don't lose her. It's Kathy.
Okay.
Yep.
Hey, Kathy.
Hi, Doc. That's what it says. Just learned about endoscopy. Have gastroparesis.
You think you have gastroparesis.
History of IBS-D.
That just means irritable bowel syndrome with diarrhea. Okay, and it's a made-up disease.
Well, it's all the same
for
stuff.
Television, by the way.
Right, for television. 5+ years, which basically means, you're eating the wrong stuff at the wrong time.
You have an upset stomach, and...
No history of diabetes, though, or surgery. Any connection between these two? GI problems? Any suggestions to help? You may need some more information, but
I
first
would need
of all...
a lot more information. Okay. But what we're looking at here is fairly typical. So you end up with somebody with many letters after their name, these degrees.
Okay.
So they'll pass a scope down there to try to figure out what's wrong. And what they found out with you is they couldn't figure it out, right? Irritable bowel disease with diarrhea is not a disease.
It is a symptom.
It's a symptom, okay? What is causing it? Well, I don't know.
Worm.
So then they go ahead and they pass something down. Your goozle, okay? And they look at your stomach. Well, we don't find any ulcers and nothing that looks like Barrett's esophagitis. There's no Meckel's diverticulum. There's nothing to see there. So we're going to say you have gastroparesis. Gastroparesis just simply means that that the gut isn't moving along as quickly as it should. So what I'm going to recommend that you look at is what you're eating. So what your diet consists of, because you're doing something that is altering the autonomic nervous system of your gut. We're a lot like a worm. Okay, so if we cut our heads off, the gut would continue to have its little action, its peristalsis, and it does it through a series of ganglia or small brains that run from the neck all the way down to your bottom. And when they become dysfunctional, things don't work so well. There are lots of things that you can do to disturb the autonomic nervous system. The place I would start with you would be to pull you off of all soy products. Very important, because it disturbs the way the pancreas dumps into the gut. You need to look at what you might be doing to disturb your gallbladder. If you don't have a gallbladder, that's what's causing your issues right now. When you do surgery to remove a gallbladder, you disrupt something called the celiac ganglion, which is a big, massive bunch of nerves right there at the junction of the gallbladder, the liver, and the common bile duct. So forevermore, you're going to have problems.
to the show. You know, we have a really good time here on Stages of Life Radio, both during the radio part as well as, we're also on the social media. So you can watch us live on Facebook or Periscope. I think we're even on Twitch and LinkedIn, you know, and all those crazy places.
All the ones I don't know what they do.
I know, but I do. And that's the fun part. So if you miss anything, you can go back and watch the video. See Mr. Smirky Face over here.
Yes.
That's me. Yeah, but seriously, Stages of Life Medical Institute. Follow us on the social media, and you can get your questions asked, and we can giggle along during the commercial breaks that are going on during the radio show. If you want to check in with us, you got a question for the doc, we are definitely, operators are on duty right now, as a matter of fact.
They sure are. They're getting paid overtime because it's Sunday.
Yeah, 407-422-1212, or you can also text us. I didn't even bring the text line up. This is how live radio goes. 23680. That's 23680. Dr. Dave is with us every Sunday afternoon from 4 to 5. Doc, how you doing? What's up?
I am feeling pretty darn well. Just making it. It's just great here being in Florida. You know, flip-flops, shorts. Just like it is up in New Hampshire right now.
No. I'm not actually sure about the New Hampshire part, but I do know that across the Midwest and like Iowa this past week, it wasn't pretty.
Yeah, well,
it was like 20s and stuff.
Yeah, snowshoes not.
Right.
You know,
so.
yeah, I've got my garden flip flops on because I was out. Yeah, actually, I was out in the garden this morning, doing my usual Sunday weeding and spraying. Just beautiful down here.
Oh,
it is just a spectacular.
Today, especially with the time change and everything, it really was a very nice day out there, except for the allergens.
They were tough today, weren't they?
Yeah, they've changed.
Which is something we can talk about. What can you do about allergies?
Help.
But first, what I wanted to do though, and this
Okay.
is going to be the question of the day. Okay, we're not going to give away a T-shirt because I didn't wear anything underneath it.
Oh, thank you.
So how does this work? And the question is what singular process can cause osteoporosis, heart disease, and dementia? All right, and the reason I ask this question is because that's really the essence of what I do. What should a physician do? What do most physicians do? What does your physician do? And what can I do for you? As if, you know, and the question is answered as follows: is that when you look for singular causes for common disease states, you tend to find singularity in the solution set. And what does that mean? It means you find common answers. So what causes all three of the above processes, osteoporosis, heart disease, and dementia, is something called hypoestrogenemia, low estrogen. Wouldn't you know it? So women are far more likely to develop osteoporosis than are men, because men's estrogen climbs with age. Wouldn't you know? With regards to Alzheimer's or other types of dementia, having no estrogen leads to that as well as other processes, and heart disease, which is on the rise in women. It's now the leading killer of women. What do you do? So the answer is this. The answer is to check your levels. Find out where you are. I do not really care as much about whether you're having hot flashes or you're dry down below as I am what your levels are. What's your estradiol? What's your estriol level? What's your progesterone? What's your testosterone level doing?
And these things fluctuate, right?
They fluctuate a lot.
Okay.
But they inevitably head down. They go south. So testosterone levels diminish. And by the way, it's wickedly important in women because that's the first thing that goes away, and it's the earliest change with regards to osteoporosis. One of the easiest things in the world to fix. Libido goes away. A lot of things go away as testosterone goes away. The immune system takes a hit, but of course, we all know that testosterone is only important to men. Not.
Oh, that's not true,
Not.
is it?
No, it's not. So this is one of these common misconceptions that gets people into trouble. And not knowing more than your doctor about this is destined to get you into trouble. So I have made a lot of friends. I've made more enemies going over the sorts of things that you need to ask and the sorts of things you need to really demand. Is it truly healthy for a gal in her 50s to have an estrogen that's lower than mine? And the answer is obviously not.
Why? What's the problem?
The problem is this. The problem is that people are dealing with misinformation that was promulgated in the 1970s and 1980s. Well, don't we all think that estrogen causes cancer? Let me ask this question loud enough that at least 200,000 people are going to hear this. Pay close attention. Your estrogen was highest when you were in your 20s and 30s. Teenagers, really. Okay, youngsters. That's when your estrogen was the highest, and that's when the risk of cancer is the lowest. It plummets after the age of 50, and your risk of cancer climbs dramatically after that age. So if estriol, estrogen, estradiol, estriol, estrone, whatever, any of those were to cause cancer, it would be at the young age, not at the older ages. That's a fact. With men, we'll deal with men also.
Okay.
So if testosterone caused prostate cancer, you would have gotten it as a teenager when you had all those zits and you were running around looking for men's magazines. That's when your testosterone was the highest. So if it caused prostate cancer, you would have had that at a young age, not when you're 70 or 80, when your testosterone goes down to that of a chick. So that's really what it boils down to, is using your common sense, not paying nearly as much attention to the commonality of the media, which is really just exactly wrong. It's highly misleading, but use your own common sense. If the sky is blue outside, I don't care how much they say it on television and advertisements. It is not nighttime, okay? Look outside.
Right.
Okay, stick your hand out there. Is it raining? Is it not? Don't ask Alexa, the name that she'll never be asked again on this show, okay? Because we have actually bought things like cars for people by saying, Alexa, please get me an annuity.
No.
Okay, oh, wouldn't you know it? At that point, okay, your phone blows up for the next year.
It's not good.
So what do we do at stages of life? The idea here is to bring people back to a state of health. That's what we do. So it's not a simple matter of, gee, we're going to sell you pellets of hormone, because we don't. We are going to sell you shots of testosterone, because I don't. The practice isn't geared that way. What we do is we figure out why you're feeling bad, why your system is not doing so well. And my favorite patient of all are people where everything is okay.
Everything's okay.
And we decide we're going to keep it that way. Because I'll tell you what, when things are on an even keel, whether it's a ship, a plane, or anything else, it's the easiest process to keep it going that way rather than waiting until you're in a tailspin to figure out how to get it back to altitude and attitude. So as a pilot, we had to go through stall, training, where you would take your plane, you'd be cruising along, and then, either nose up or you cut the power back and immediately fall into a tailspin. And the trick is to figure out how to get out of it. Okay, so rudder,
before you
rudder before you die. So rudder in, nose down, and usually you pull out pretty quickly, right? That is the way we do it at stages of life, to figure out what it's going to take to get you back at altitude and attitude. That is what we do. So we use all tools available to us, all of them, not just a handful, but all of them. We use nutrition. And not, gee, we're going to go out and buy super beets. That's an absurdity. No single product, no single anything is going to make you anything but less wealthy. Promise. That's life. We're not going to go out and sell you a hat to make your hair grow back. It doesn't work that way either.
I love that with the lights.
The lights.
It,
oh, yeah.
We're in Florida. Hello.
Yeah.
If that works.
Yeah, or you put it, if you really want to do this, put a heating pad on your head. You'll do just every bit the same thing. You're delivering heat. Vasodilatation. People have tried these ultraviolet things, all kinds of crazy stuff to grow hair back. It just kind of doesn't work. But at stages, what we do is we look at restoring balance in diet, nutrition, and those are two different things, as well as hormone balance. And we use prescription medications as well as natural ones. Why? Because everything has value. Everything has value. Aromatherapy has limited value, but it does have value. Chiropractic has value if you know how to use it and when to use it and why to use it. At stages, we try to get people value. We try to get them back as cost effectively as we can. And do we do it? Absolutely.
Oh, yeah.
Yeah, on a routine basis. It's fun. It's the most fun I've ever had as a physician because we actually make people better.
Cool idea. And you guys are accepting new patients, I believe.
We accept new patients. We take new patients on a daily basis. One of my most fun things is figuring problems out. And if I weren't taking new patients, I would probably go completely out of my mind.
407-679-3337. Again, 407-679-3337. Or you can go to stagesoflifemedicalinstitute.com. and get the process started. If you would like to check into becoming a patient, now if you want to call the show, you can do that at 407-422-1212. Again, 407-422-1212. We're going to take a quick break, check the news at the bottom of the hour and all that good stuff that goes along with it. Be right back at Stages of Life Radio. There we go. Okay. Yay. All right, and we'll see you in 4 minutes. Okay, so how we doing on the social media? I see we have a handful of people watching the show. Thank you for being there. Got any questions for the doc? If you do, just go ahead and pop them in the comment line. Otherwise, we can continue on with what you were talking about with regards to everything being connected with, the whole estrogen, estradiol, progesterone.
There are 3 different estrogens that are important to human physiology.
Okay.
So we'll lump it all together and say, well, gee, estrogen this and estrogen that. There are 3 different estrogens and they do different things. Mm-hmm. One of them, estradiol, has 2 different metabolites attached to it, one of which is can be dangerous and the other one is actually protective. So when you're looking at the chemical analysis in your blood, you really have to know what you're doing. You have to look at the total balance. So if you're looking at a man and you're looking at a testosterone level and you don't know your estradiol level, you know nothing.
Oh.
You know absolutely nothing, because the reason you have it checked more times than not has to do with, let's say, difficulties with intimacy. A polite way of saying ED.
Oh.
So, well, if I was impotent, I was going to dress impotent, the old joke. So you've got a little ED, do you? So you're taking testosterone. So we'll check your testosterone levels. I just cracked Melissa up, I think, a little bit. All right, yeah. But if you don't know your estrogen, it doesn't work. Why? Because you're dealing with a testosterone to estrogen ratio that fires off the hydraulics.
Right. Okay.
People come in all the time. Well, I'm taking 200 milligrams of testosterone cyprinate and they blah, 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 blah. And their estrogen level is 4 times what it should be. You don't think that that's going to influence the way things operate a little bit? With women, it does the same thing. So if you've got just a little bit of estrogen and no progesterone, you're going to get hot flashes. So what do the docs typically do? They give you more estrogen because they don't check your blood levels, nor do they know necessarily how to interpret them.
Right.
So the ratio of estrogen to progesterone is what fires off a hot flash. So too much estrogen or too little progesterone can do it. Matters of intimacy, estrogen to testosterone ratios. Matters of fatigue, thyroid to cortisol ratios. ACTH to cortisol, TSH to T3 ratios. There are lots of these little ratios. And when you're looking at the absolute values, well, I want to see the H's and the L's, you'll never go anywhere. Because it isn't a matter of singular scalar values. It has to do with ratios, constellations, and it's far more interesting than a simple number. I want to know my CRP. No. That's not what's important here.
Okay.
So that is what we do.
That is very cool.
This is very cool.
It is.
And then some of the preventive maintenance stuff. We do cancer antigen testing, things that you can't get your insurance to cover. If you went out and paid cash for it at the big boxes, it cost you about $1,800 to $2,000. We do it for $350. So we'll check for 6 or 7 different cancer antigens, and you do that to try to detect problems before. Cool. Guess what? The animals are out of the barn.
All right, before the
Smart
animals
money.
leave the barn, we've actually got Ron, we're gonna take his call out of the break, and we got a couple of texts as well. So this is just our 30-second warning sign. Hey, thanks for watching us on the social media, friends, and we do answer the questions during the commercial break, because most shows they go take a whiz, eat a taco, things like that, run around the hallway.
If I raise my hand, can I go to that?
It depends. Are you gonna do that whole?
No, I won't do that whole thing. Although there is a camera in there, so I can stay live. Just kidding.
No, there's no camera in my bathroom.
No cameras there.
None at all. Welcome back to Stages of Life Radio, right here on News Radio WFLA Orlando. I am Melissa Fox, along with Dr. David Klein from Stages of Life Medical Institute in beautiful Longwood, just a stone's throw off of I-4 and 434. Matter of fact, you can stop by, get yourself a coffee, a rib sandwich, and then go across to the
Four Rivers
doctor's.
is right across the street.
Yeah,
Best
and
barbecue in the country, probably.
Yep. Very good stuff. Anywho, so Stages of Life Radio is live. And that means we should be taking some phone calls. So let's go ahead and get to Ron. He's checking in from Castleberry.
Cool.
Ron says he's 79. Hey, Ron, how you doing? Wants to know the best way to diagnose a torn gut. Is that right?
I don't know. I can't really see it.
Glute.
Gluteal?
Gluten. There we go.
Go for it, Ron. What's your problem?
My doctor, my primary said I had a torn glute. You know, I lifted something really, really heavy. And I walked a little bit with it, and I felt the pain in my butt, my right cheek. So I went over there, and he took his finger and poked it here, there, and everywhere and said I had a torn glute. Now, he recommended muscle relaxers and pain pills.
All right.
Well, the muscle relaxer wound up giving me vertigo.
Okay.
Wow.
Well, Ron, here's
So I stopped that after.
Yeah.
Right, but basically, he sent me out for X-ray and to go to Cora for therapy.
All right.
Well, I don't know if I have a torn ligament, muscle, tendon, or combination of all three.
How about none of the above?
I'm a little leery about going to.
Yeah.
Yeah, I'm a little leery about going for therapy and maybe make a bad situation worse.
Okay.
I would think an MRI or a CAT scan would be more definitive.
Okay. You're right now. What you're doing is you're throwing spaghetti against the wall, trying to see what's sticking. So let me make this real easy for you, Ron. Okay. You didn't tear a gluteal. There are three gluteal muscles: gluteus maximus, medius, and minimus. Three of them. The one you probably damaged was the gluteus medius. The gluteus medius is an external rotator of the hip, so if it's on your left hip, you are lifting something and twisted to your right. If it's your right hip, you lifted something and twisted to your left. It's also injured playing
That's exactly
golf.
what I did.
Of course that's what you did. Now, is it a tear? The answer is no. It's a stretch, a strain. Are you going to pick it up on CAT scan or MRI? Negatory, Batman. It is not going to happen.
Okay.
You are wasting your time and money. You're getting irradiated the pelvis for no particular reason whatsoever except to amuse and enrich the radiologist at this point. Now, what I'm going to suggest that you do is not necessarily take the muscle relaxant, because that's not how you deal with the problem. Again, it might make you dizzy, wouldn't you know? I do use muscle relaxants in my practice.
I did stop that after short fashion.
No kidding. The best time to take it is when you're trying to sleep at night, because they facilitate sleep. Then it works well. But the right thing to do wasn't giving you a pain medication, but to give you an anti-inflammatory. So it could have been naproxen, it could have been meloxicam, it could have been any one of 50 different anti-inflammatories, and it would have been a better choice than a pain medication, because the pain medications make it worse. Now, how does that happen? Now, I've got, 3 boards in pain. So I've done this for 42 years, opened the first office-based pain center in the United States. I've been doing it a long time. When you have muscular pain and you give somebody a narcotic, it feels better for 2 or 3 hours, and then the muscle starts going into spasm as the serum level of the narcotics tends to drop off. So it gives you a couple hours of happiness and another 4 to 6 hours of misery. The way that you treat this, now, is physical therapy helpful? To some extent, it might be. What they do is they amuse you until it heals itself. I will suggest this to you as far as physical therapy is concerned. Soak in a tub of hot water. Draw a bath, throw a third of a cup of Epsom salts into it, and soak in it. You'll feel better if you do that once or twice a day after about a week. You'll save yourself a lot of time. You'll save Medicare a bunch of money, and you'll do well. The way we treat this in the office is if somebody comes in and they just can't stand themselves because they can't drive in their car, I'll drop a little bit of a local anesthetic and a little bit of a steroid right where that muscle attaches on the bone called the ilium, and it'll feel better in about 2 minutes. That is all it takes to fix this. But to go ahead and do a mega bajillion dollar workup, radiological workup, is crazy.
407-422-1212. Again, 407-422-1212 if you want to take Ron's line. We've got a couple of texts as well. The text line is wide open at 23680. If you want to leave your name and where you're calling us from, that's cool as well. Or texting, I should say. Dr. Klein, if you're efficient and careful with blood draws, why does it take 2 weeks to get the results?
Because that's what it takes sometimes. In our office, we'll do it in 2 weeks. At Quest and LabCorp, it takes 3. It has to do with the economics of how you run them. So it's not like it is on Star Trek, where you pass the tricorder and it gives you the answer. So we're going to run all of our CRPs at one time. We're going to run all of our L-glutes at one time. We're going to run all kind. How often are we going to do interleukin 6s? We don't do them every day. So we'll run them on a weekly basis. Otherwise, we'd never be able to do them economically.
Makes sense.
So we run labs every day, but all of the labs aren't run every day. So we'll do CBCs, urines. Those things are done every day. Electrolytes, those are done every day. But when it comes to hormone studies, no. In order for us to deliver those at 1/7 of the cost that's done at the big box, we run all of our estradiol on one day, estriols on one day, progesterones and testosterones on one day, but we may not do our parathormones until the following day. So when I like to see my patients, I want all of the data back, not just half of it. So we have it mapped out in such a way to deliver healthcare efficiently, cost effectively, and actually a third faster than the commercial labs. So I'd say that's a pretty good guess.
Yep.
Now, just to prove a point, okay, we went ahead and started running these things. So while the patients were sitting in the office, just to see if we could do it. The cost of doing it was a little closer to $2,000 than $495.
Ooh, okay.
So, and we make that available to people. If you want it done while you're sitting here, just write a check for 2 Gs. Do I think that's smart?
No. Really not.
No. I think you'd be foolish to do that. We do have people that come from outside the country, and they'll do it because they want to know before they get back on the plane. But for everybody else, I just have to tell you that I just think you need your head examined. Now, but even things like the cancer antigens, which we do, again, for 1/7 of the list price of these things. We do those every 2 weeks because we batch them.
See, otherwise it just costs too much to run them one at a time, my friends.
Makes no sense.
Right. Here's another one. Marla, hey, thanks for checking in on the text line, again at 23680. Is an MRI necessary if you have severe knee instability and effusion and arthritis on the knee and the brace and topical pain meds are not helping?
Do I think it's necessary
to have an MRI?
An MRI is like any other laboratory study, radiology study in this case. You do MRIs if you think that it's going to result in a surgical solution. So if you think you're going to surgery or you may need surgery, the MRI is essential. If you think that your diagnosis needs refinement, is it pseudogout? Is it a septic joint? You may want to do these sorts of things. But otherwise, I dissuade people from doing MRIs just for simply doing them. My knee hurts. No, I'm not going to recommend an MRI unless I thought that there was a possibility you needed surgery.
Is that how people sound to you?
Yeah, they do. No, well, what happens is folks think that just because you have a piece of film that says that it's got this radiologic finding, that there's causality. It's just because you have a zit on your forehead doesn't mean it's causing your headache. All right? No. That is the way these things work. So do I think it's essential? No. I think it might be necessary, but it depends on the circumstance. If you've got an unstable joint, you're walking along and that knee just goes sideways and down you go, that sounds surgical to me.
So therefore MRI.
In that circumstance. But if you walk along and, gee, my knee hurts, the answer would be no. If you're saying, I'm never going to have surgery again, then I'm not so sure that an MRI is really all that important. I would just get a knee stabilizer and move on from there.
This question came in a little bit earlier. Is there a cholesterol vaccine?
No. I love simple answers. What is cholesterol anyway? Do you know what cholesterol is? We have people that say, well, I want to know what my cholesterol is. And I'll say, I'll answer your question if you'll tell me what it is. What is cholesterol? They go, I say, good, then let me drive the bus. Okay, cholesterol is a steroidal background. Mm-hmm. It is the first What it is, it's a chemical that the body uses and converts it into a hormone called pregnenolone. That in turn gets converted into 150 different adrenal hormones. Wickedly important to what you're doing. Wickedly important. What else does cholesterol do? Your body uses it as a Band-Aid. You're going to go, what in the heck am I talking about? It's a Band-Aid. It floats around in the blood, and it helps cover over areas of inflammation within arterioles. Those are the little tiny arteries. Mm-hmm. So where does this happen? When they bifurcate, they split. So there's a Y in the road. When you see a Y in the road, take it, right? That was Yogi Berra. Yeah. Just make a decision, go. But the problem is right at the crux of that Y, the blood cells hit up against that thing just like they do periodically on the interstate. There's little bumpers that are there. Sure. That they're painted yellow so you don't hit them. And then you drive along one day and all of a sudden you see somebody's fender on it. So when the blood cells hit it and the fender ends up on those bumpers, it breaks down, causes inflammation, platelets aggregate on that area, and it can cause stroke. So the body uses cholesterol as a Band-Aid to cover those areas. So cholesterol is not bad. Too much cholesterol is. So is there a shot that you can get to decrease cholesterol? The answer is no, but there are many ways, some pharmaceutical and many that are nutraceutical to lower cholesterol. So we do it all the time using combinations of folic acid, NAC, berberine, bergamot, olive leaf extract, inositol. There are lots of things you can use instead of going with statins.
You are listening to Stages of Life Radio, brought to you by Stages of Life Medical Institute, at which, well, Dr. David Klein is pretty much the guy.
I'm it.
Yeah, you're it.
Yeah, when you come to Stages of Life, who do you think you're going to see? Ghostbusters? You'll see me.
That's right. So check them out at stagesoflifemedicalinstitute.com, or if you like, give us a call now, 407-422-1212, or text us if you're shy at 23680. This is News Radio WFLA Orlando. This is a very short break.
On guard.
So I had 2-minute break because
I know.
Because I can. Actually,
somebody backed out of a spot?
No, they
even better.
Yeah, no, there's only 2 minutes scheduled, and I refused to put public service announcements.
Oh, good.
There's no need for fillers.
Yes, I agree.
Mm-hmm. Yes. So anyway.
So I'll do a quick PSA. Go out and vote. Just do it intelligently.
Just hurry up if you haven't already.
Yeah, just get it over with.
I got one from Herbert. What if the estrogen is low, the testosterone and FSH and LH are near zero? I've been taking testosterone and Clomid, but the ED...
Clomid? That's why the FSH and LH are low.
And the ED problem is still there?
Yeah. Well, you have pituitary failure. Either it's induced or it's primary. So you need to have FSH and LH in order for your gonads to start kicking up testosterone. What I would do with you would be to start you on transdermal testosterone. Simple enough.
There you go. Transdermal.
Easy, it's cheap. My patients get it for about $28 a month. Mm-hmm. So a 3-month supply, I think, is $84. Does it work? And the answer is yes, that's what I take. Although I keep that as a secret from my wife. I want her to think that I'm 66 and very young. Virile, yes. Virile. Yeah, I fooled her. You know what I mean? Otherwise she wouldn't have married me. I'm convinced.
Oh, stop. I'm convinced too.
Yeah, well, now that the cat's out of the bag, she'll probably leave. So.
I'm getting Goo Creek texts. Okay. Wait, I have a pumpkin. Okay, so 30 seconds and we're coming back. That was a great question, Herbert. Thank you very much for sharing that. Yep. Okay. So this is the last segment. Anything you want to get in there, we need to do now.
All right. Well, you know, they've opened up the cruise industry.
Hey, it's Stages of Life Radio on News Radio WFLA Orlando. I am Melissa Fox from Good Morning Orlando. What's up? Oh, I see. Yeah, you get to see a little more personality here when I'm hanging out with Dr. David Klein, who tries to keep everything on track.
Yeah, right.
I know.
That's my middle name.
Meanwhile, his wife is over there going, no. That's my job. Okay, thanks though, but she doesn't talk. So anyway, this is the last segment of the show, so if you want to get your questions in, you best get on the stick now. 407-422-1212. Oh, And we have some, here's some good stuff off the text line. If you'd like, you can put your name in there and where you're checking in from as well. Have you heard of the Beamer device?
Yeah, it's a multi-level marketing deal.
Great.
Yeah, it's tremendous. Yeah, it's one of these kinds of things where you spend several $1,000s for a device, several thousand, a little more. Mm-hmm. And, well, gee, the folks at NASA know all about it. Yeah, the folks at NASA know a lot of things, especially from the satellite recon photos. So do I suggest that you run out and buy a Beamer from your neighbor who's selling these things on MLM? No, if you're going to buy a Beamer, buy a car. Next question.
Okay, yeah, seriously, and one of our friends...
Every day I get people coming
It's psychosomatic, I mean, too, though, because
get a hot tub. It's cheaper.
I know people who are trying it or using it or borrowing one from a friend. I'm like, please don't spend $5,000 to $7,000.
It's a lot of money.
And I love my friends who are actually selling them or tried to get me to sell them. And the first thing I went was, no, so you were selling magnets, and now you're selling...
Right. Yeah. My former wife was into these Nikon magnets.
Yeah,
okay?
exactly.
And so, well, gee, Doc, can't you sell these things for me? And the answer is, no way. Are you kidding? No. So if I wanted you to have magnets, I'd just send you down to the space store and say, buy yourself some magnets, stick them under your bed. These sorts of things are fads. If they worked, they would be all over the darn place. Okay. And they wouldn't need multi-level marketing to make it.
Now, apparently, our other friend, Dr. Kronhaus, I was on today earlier, and mentioned that that Novartis has developed a vaccine for statins. That's what this person says. Something approved in Europe. So
there's nothing available in this country to lower cholesterol. No, there's no intramuscular statin.
Okay, so we'll look into that. But at this moment,
But also understand something, that when you're administering medications or administering therapies that go after enzymes, in particular, they can be highly damaging. Case in point are those happy women that are out there getting these shots and tablets for osteoporosis, something called bisphonates. So what does it do? Well, it slows down osteoporosis. Do a little research on your own, and I mean real research. Go to the National Library of Medicine and look up bisphonate of choice. So just look up Fosamax. Look it up, and then osteomalacia. Look up osteonecrosis of the mandible and hip. So what happens is it slows down the regeneration of the bone also, and they break. So the increased risk of hip fracture when you use things to treat osteoporosis in that manner. You don't want to be using irreversible mechanisms and means to shut down enzyme systems. Things end badly. There are very, very few examples of where that's actually worked in the long run. So while it may be available in Europe, that would be the last thing I would do here, would be to give somebody a 1-year shot of something to shut down an essential enzyme, and then have to worry about checking their pregnenolone levels, cortisol levels, I mean, you're talking about checking people on a monthly basis. It sounds like a really good financial incentive for a guy like me. However, I think it is a really bad idea for you.
There you go. 23680 if you want to text something in. We've got a call from Mims. Jose's on the line. He is 77. Wants to know why he has a high heart rate. He's had high BP for a long time. Hey, Jose, how are you?
Good.
Good. Welcome to the show. Tell us what's going on. Is it Jose or Josie? Who am I talking to?
Jose.
Hi, Jose. All right, so tell us what's going on, darling.
Well, I've had high blood pressure since 1993.
Oh.
All right.
And I just got it under control about 3 years ago.
Okay.
But now I'm having off and on high heart rate.
All right, what medicine?
Blood pressure's better.
Yeah, what medicine are you taking for the blood pressure?
Pardon me?
What are you taking? What medicines?
At this time, I'm taking nefenfetapine and metoprolol.
Okay, metoprolol and nifedipine.
The metoprolol hurt my muscles so bad, deteriorated them. Just yesterday, he started me on 90 milligrams once a day, nefenfetapine, and one anatenidol, 25 milligram once a day,
all right,
which is similar to metoprolol.
Yeah, well, they're called beta blockers. What they do is they slow your heart rate up. They're not the world's best blood pressure medicines, but they are necessary to control heart rate. So, do the beta blockers cause muscle pain? Not typically. It's very unusual for that to occur.
Well, my muscles, I'm all flabby. I lost my breast, my boob, my arms. I've got I got my bone showing. The bone, you can feel the bone, but all the skin's different. I've lost muscle, a lot of muscle.
There's other things I'd be looking for. I wouldn't just simply say, well, gee, it came from the beta blocker. There's a lot of possibilities there, babe. And that just wouldn't be what I would do. So far as the blood pressure is concerned, that's one factor. Heart rate is another. You can have a heart attack if your heart rate goes up too high inappropriately.
Yeah.
So you're just going to have to find the right beta blocker to do this. They can do the same thing with digitalis. It's just a little bit trickier. But yes, so you're going to have to find the right beta blocker. My favorite one is...
What would you suggest?
I use propranolol ER. I use a sustained release propranolol. I find that to work best.
Can you spell it?
Propranolol.
P-R-O what?
Propranolol.
P-O-R-P, I'm sorry.
Just look up, it's okay. Look up Inderol.
I don't have any technology. I only have a phone.
If you have a pencil, that's enough technology. So
I got it.
Listen to me. Inderol. 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 And you'll find it from there.
Yeah.
Cool.
Okay, and that's the brand name.
I've had high blood pressure since '93, and it's only now that every doctor in the world just got it a little under control. But
got it. Okay.
It's been under control a little bit, but I'm having trouble now for the first time. A little bit of heart rate, not all the time.
All right, we got to go. I wish there was more show, but we really got to head out. Any information that you were looking for that you might have heard about, stagesoflifemedicalinstitute.com. Hey, Dr. Dave, say goodbye.
Adios.
How could I find him in Lake?
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts most insurance and Medicare too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.
This hour, we're having a salute to a recording artist who says that his biggest source